Out of all of the sleep challenges kids can go through, watching your child struggle with night terrors is perhaps the most alarming and concerning. While most pediatricians try to alleviate parents' concerns by telling them it's no big deal and they'll grow out of them, we dig deeper, and clinically we often see night terrors and other significant sleep disturbances in toddlers and young children continue to show up later in life as other forms of sleep disorders, sensory processing, and emotional dysregulational challenges, and more. Sleep is perhaps the most crucial of all of our core health functions. So when it's offline and not functioning properly, it's often a sign of stress and trouble brewing in the brain and nervous system for that child. If you're concerned about your child's sleep and concerned they're having night terrors or they had them in the past, this video is for you. We'll talk about the difference between night terrors and nightmares, and then break down the root cause of sleep challenges in kiddos and what you can do naturally to get things back on track. Please share this with other moms and parents who need to hear this message. The definition and characteristics of night terrors. Night terrors and sleep disorders are intense episodes of fear or dread that occur during non-REM sleep in children between the ages of 2 and 6. They are different from nightmares and can be distressing for both the child and the parent. Understanding night terrors. Night terrors have distinct characteristics that set them apart from nightmares. They occur during non-REM sleep and are usually not remembered by the child. Night terrors can be more intense with physical manifestations such as sweating or rapid breathing. So what are some causes and triggers? Children struggling with night terrors present with an overactive sympathetic nervous system, which we nickname gas pedal side of the nervous system. So this gas pedal side of the nervous system is supposed to fully wind down and shut down during sleep. But for many kids who've had a stressful entry into this world with birth interventions and trauma, or struggled early on with common things like maybe colic, reflux, constipation, or chronic ear infections, that system is stuck on and interfering with their sleep at night, leaving them more wound up and stuck in that fear and stress state than we'd like for them to be. So what is the impact? Night terrors can have short-term emotional and psychological effects on the child, as well as disrupt sleep patterns for both the child and the parent. There's also a potential link between night terrors and other sleep disorders or neurosensory conditions later in childhood, such as sensory processing disorder, ADHD, and anxiety. These neurologic links go back to the child being stuck in sustained sympathetic or gas pedal overdrive state. So coping and care strategies. If you're watching this video, you've likely already tried creating a soothing sleep environment, implementing consistent bedtime routine, white noise machine, magnesium, and melatonin, and so forth. If you tried everything and your child is still struggling, let's dig deep and get to the root cause by finding out if your child is stuck with the gas pedal on and in that sympathetic state. So the number one benefit parents report once their children begin getting chiropractic adjustments is improvements in sleep, because our adjustments work to activate the brake pedal and the rest and digest side of the nervous system, restoring balance to the brain and body so your child and whole family can get back to restful, full night's sleep night after night. If you think your child's nervous system may be shifted and stuck on that gas pedal, give us a call, send us a DM, learn more about how we can help you and your kiddo.